Just briefly on the current Australian situation, as of midday today, there's been 6 new cases in the last 24 hours, all in hotel quarantine. No locally acquired cases, continuing that very positive trend. Just to pick up on the PM's view there, that we should be thinking out beyond cases, but to the effect, the serious effects of the disease. There's only 9 people in hospital in Australia right now, and recognising that some of those are in hospital because that is the way that positive cases are dealt with in a couple of the jurisdictions. There's very few people that are seriously sick, in fact, virtually none. There's no one in intensive care, and we haven't seen a death in Australia from COVID for some months. Contrast that with other countries. In the week up to the 3rd of February, I spoke to National Cabinet today about that. In the US, they had over 1 million cases in that week and over 20,000 deaths. We are in a very different situation. We have been all along, and that is a lot of that is to do with the strength of our hotel quarantine systems and our border controls. So we continue to have a good situation here. In the last week up to the 3rd of February, we'd only had 42 cases overall. All but 2 of those were overseas acquired, and the other 2, as we know, has been reported in WA and now in Victoria in quarantine workers. So it's a very different situation. We also talked today about the variant of concern and the Australian and New Zealand experience in relation to that. And again, that's a very different situation to what we've seen with that increased transmissibility of the virus in other settings. So in the UK, in the US, in South Africa, we've seen those variants that have cropped up in those countries but are now spreading in other parts of the world to cause major concerns in terms of the epidemiology of the disease. Here in Australia, we've had cases, not of the Brazilian strain yet, but certainly the South African originating strain 1B1.351. We've had 15 cases of that. We've had 76 cases of the UK strain B117. Both of those are more transmissible. We've had only 2 of those cases out of that entire group have been in the community. They've both been in quarantine workers. So up to the 3rd of January, and then there's one extra one now. So we've seen the South African strain in New Zealand and how that has emerged from their quarantine setting. Again, with the very strong public health response in New Zealand, as we've seen in Queensland, as we're seeing right now in WA and in Victoria, it's come under control. It's a very different setting. So we have a virus which is more transmissible, but very different settings here in Australia and indeed in New Zealand in terms of the public health response. Other responses, as we've seen in different states, have been slightly different, but that public health response has been important, and the response of the community. So we've seen, again, in WA, who haven't seen cases for many, many months, when the community has been asked to wear masks, they wear masks. When people are asked to go and get tested, in WA in a few days, they went from 500 tests a day to over 17,000 tests in a day. Extraordinary response, and that's an incredible, wonderful thing for the community to be responding like that, but it's the key to these variants for us. It's getting onto it quickly, dealing with it quickly, the response from the community also reflecting that, and that makes us, as the PM has said, much more comfortable with those variants at the moment. But of course, we need to continue to learn from these issues. Quarantine, as the PM has mentioned, we discussed. There is absolutely a need to continually improve the quality of our quarantine. It is already really top class. We've seen only a small number of incursions from quarantine, and we need to understand these are complex systems with humans, and there is always an opportunity or a chance of human error. There's also chance issues like 2 doors opening across a corridor, as has seemed to have occurred in the Victorian situation. So we do need to continue to look at these things. At the National Cabinet, I think it was a month ago, it might have been earlier, a set of general principles were agreed. We can look at those again to make sure that all of those things are being done. But that the system has worked very effectively up to now and continues to work very effectively. And it's a range of matters, not only the variants of concern, but the way people move, the way people are working within those environments, and a range of measures that can be done to continually improve that. And we're absolutely going to do that and give our health advice from our HPPC into this new group that the PM has mentioned.